Hi everybody, this is Dr. B at Prestige Dental in Pasadena, and today I want to talk to you about dental implants. Specifically, the top 5 questions you should ask your dentist after having an implant placed. First question is, what is the manufacturer and model of the implant that was placed? So just like car manufacturers, there are many different manufacturers that produce dental implants. And just like car manufacturers, each one may produce several different models of vehicles. So in the dental setting, the manufacturers may produce more than one type of dental implant model. So it's very important that you know the manufacturer and the model of the implant that was placed. And it's also helpful to ask about the size, the length, and the width, and keep that information stored somewhere safe in your dental records. The reason this is important is because down the road, if the crown that's on the implant ever has any problems or the implant itself has any problems, we need to know the specifications of the implant so that we can order correct parts, so we can remove the crown and repair it and that sort of thing. So this is extremely important that you know that information so that we can reference on that for future use. The second question you should ask is what type of cement was used to attach the crown to the implant. There are temporary cements that some dentists may use. The advantage of those is they are easier to remove in case the crown needs to be repaired. However, those are more likely to inadvertently come loose. On the other end of the spectrum, you have the permanent cements that are used. And as the name suggests, those typically will not come loose. The disadvantage of those is it's a lot more difficult to repair the crown should it be necessary without damaging the restoration as you're trying to take it out. Somewhere in the middle are the semi-permanent cements, and those are typically labeled as implant cements. So second question you should ask your dentist is what type of cement was used, and again, store that with your dental records so that if need be, we can reference off that and we will know what we were working with if we try to remove the restoration later. The third question is, what is my recommended cleaning frequency now? Most adults typically with healthy mouths, we recommend twice a year for the dental cleanings. However, if you have a dental implant placed, we may recommend 3 months or 4 months or more frequent regimen for your cleaning appointments to make sure that we can monitor it and make sure that we can maintain a healthy gum environment around the implant. Fourth question is, what is my home care? Typically, we recommend cleaning twice daily with a toothbrush and flossing once daily. But around the implant, we may recommend some further things, special types of brushes to clean in and around the implant, perhaps a water pick or certain mouth rinses. So make sure to ask your dentist what is the cleaning recommended frequency for professional cleanings. Also, again, the fourth question, how should I be taking care of this at home? And then the last question is, are there any food limitations that I should be concerned about around the implant? Certain implants do not like lateral pressure, meaning biting into that carrot stick or cracking sunflower seeds on the tooth. So you really want to check with your dentist what is safe to eat around this implant and what are the types of foods that I should avoid. Again, generally speaking, you can eat most things with dental implants, but also good to check with your dentist on what is the recommended safe protocol. So again, make and model of the implant, the type of cement that was used to retain the crown, what is my cleaning frequency, how should I be taking care of it at home, and also the food limitations. Top 5 questions to ask your dentist after you have an implant placed. If you'd like more information, feel free to consult our website, and also feel free to click on the link in the description below. Thank you for your attention.